In health news, a little-known non-invasive therapy for depression.
It's called transcranial magnetic stimulation, or TMS. It is FDA approved, but very few patients are getting that treatment. News 8 medical reporter Jocelyn Maminta live at our New Haven newsroom tonight with more on how a patient can benefit. Jocelyn?
Well, Darren and Ann, TMS received FDA approval back in 2008. It also has the recommendation of the American Psychiatric Association. It is for patients who are not responding well to medication. Still, it is not on the list of possible options for people struggling with depression.
Camry DeCrosta is feeling her anxiety creeping back up again.
Just flaring up a little bit, but nothing crazy.
The college student battles what's called health anxiety.
I was crying, having panic attacks constantly. Because of health anxiety, I refused to take medication or pills.
With drugs not an option, Camry chose to have transcranial magnetic stimulation, or TMS, to treat her anxiety here at Contemporary Care of America.
Now I take any medication.
Here's how it works. Magnetic pulses reactivate the part of the brain that is not functioning.
The brain is a chemical and electrical organ. We can either treat it with chemistry, with medications, or we can treat it with using focal electrical impulses, such as with TMS.
Psychiatrist Dr. Tariq Pereira says patients like Camry,
It's completely painless.
from time to time, come back for a booster.
It's just like a little bit, so I want to just knock it out of the way now while I can before it escalates.
In her case, what was happening was the right side of the brain was firing too much and causing the anxiety.
TMS, says Dr. Pereira, works for patients who are failing medication therapy.
If you continue the medication therapy and add TMS, there's open label data showing that it could be as high as 80%.
Still, TMS is not on the list of expected treatments.
What we're missing is enough knowledge about this. There are two reasons for that. One is most psychiatrists, almost all psychiatrists practicing, did not train in TMS.
The other, detractors say TMS has not been around long enough.
The science behind TMS is very strong. There have been publications showing that TMS saves money in terms of reducing hospitalizations, doctor's visits, medication usage.
The sessions are 5 days a week, up to 6 weeks. Medicare and most insurance companies cover TMS. Dr. Pereira says people with magnetic metal implants in their brain are not candidates for TMS. He tells me that in studies, TMS is also showing promise in PTSD, migraines, and addiction.